Thank you, Mr. President. Almost everyone, as you noted, in the Rose Garden is wearing a mask today. Why haven't you required everyone at the White House to wear masks before now?
Well, if they're a certain distance from me or if they're a certain distance from each other, they do. In the case of me, I'm not close to anybody. I'd like to be close to these two gentlemen. They're hardworking, great men, but they just said, frankly, let's keep it this way. So obviously, in my case, I'm very far away from everyone. But if you look at all of those people over there, every one of them, from what I see, these are White House staffers, they're White House representatives, they're White House executives, and everybody has a mask on. We've had just about everybody I've seen today has worn a mask. Yeah.
Were you the one who required that, sir?
Yeah, I did. I think one of the things we're most proud of is this just came out, deaths per 100,000 people, So deaths per 100,000 people, Germany and the United States are at the lowest rung of that ladder, meaning low is a positive, not a negative. Germany and the United States are the two best in deaths per 100,000 people, which, frankly, to me, that's perhaps the most important number there is. Please go in the back, please.
Yeah, thank you. Thank you, Mr. President. I have two questions, one on the Ahmaud Arbery case and one on the coronavirus. The first on the coronavirus, the vice president is said to be in some sort of self-isolating, keeping his distance from people. What do you say to Americans who say, how can you keep me safe? How can you reopen the government if even the vice president is self-isolating? And why hasn't testing gotten up to the point where every American who wants a test can get a test?
Well, the vice president, first of all, has been tested, and he's negative, and it was tested yesterday, tested today, and he's negative. He's in very good shape, and I think that that's going to be fine. As far as Americans getting a test, they should all be able to get a test right now. They should be able to get a test. That's the problem with a question like that. We go through a whole announcement saying we're number one in the world by far, by a factor of 2 and even 3 and 4, depending on where you're looking. And I get a question, when will everybody be able to get tested? If somebody wants to be tested right now, they'll be able to be tested. As far as the incident, I think it's horrible, and it's certainly being looked at by many people. I'm speaking to many people about it. He looked, I saw the picture of him in his tuxedo. It was so beautiful. I mean, he looks like a wonderful young guy. Would have been a wonderful, just a wonderful guy. I think it's a horrible thing. Now, with that being said, as you know, they're studying the case very carefully. They're interviewing everybody involved, and we'll see what happens. To me, it's a very sad thing. I spoke to a number of people that are very much involved in it. I've been following that one very closely. It breaks your heart to watch it. It breaks your heart. And certainly the video was a terrible-looking video to me. But you have a lot of people looking at it, and hopefully an answer is going to be arrived at very quickly. But it's something that is heartbreaking.
Specific question about the case, if I could ask it. The specific question I have is, you said that there possibly are things that happened that were not recorded on the tape. Could you expound on what you mean by that and your thoughts on what?
Well, I saw the tape, and when they moved left, when they moved left outside of the tape, nobody saw what was going on. Nobody saw it's an empty spot on the tape, I guess. Now, do they have additional tapes? I hope. But I will say that it's something that, based on what I saw, doesn't look good. Somebody that I have a lot of respect for is Senator Scott of South Carolina. You know who I'm talking about. He's a great.
Yes, Mr. President, many Americans want to return to their normal lives, but they're afraid to do so. How can you ensure Americans that it's safe to go to their own workplaces when the most secure workplace in the country, the White House, cannot contain the spread of the coronavirus? It's infected some of your own staff.
Well, when you say some, so we have a person, and the person got something happened right after a test was done. 3 other people met that person, came into relative contact, very little contact, and they're self-quarantining. That is not exactly not controlling it. I think we've controlled it very well. We have hundreds and hundreds of people a day pouring into the White House. It's a massive office complex, including the very large building right behind us that you know so well. So I think we're really doing a very good job in in watching it, and I think it's very well contained, actually. And part of the reason it is because of all the tests we're able to give. But it was one person, and the other people were only people. They're quarantined. You understand this, Phil? They're quarantined for a specific reason. The reason is they were in the general proximity of the one person. And the one person, I believe, will be fine in a very short period of time.
Why hasn't Vice President Pence followed the CDC guidelines of self-isolation and other people who might have been exposed to this?
Well, I'm going to have to ask that he will give you that information. Whatever he is proceeding and doing, he will give you that information. I'll make sure that they put out a notice. John, go ahead, please.
Mr. President, up until now, it's thought that the most vulnerable people were those above the age of 60 or 70 or 80, and the children were pretty much, I don't want to say immune from this, but weren't affected by it. But all day long in the news today, we have been hearing and seeing this terrible syndrome that some 85 children have now. 3 of them have died. What is the task force talking about in terms of that, and what could be done about it?
We're seeing that all over the world now with young children. Very, very tiny percentage, but it's still, it's the swelling and the skin rash. And we're looking at that very closely, John. It's a phenomena that's just been brought to everyone's attention a couple of weeks ago. Admiral, you may have something to say. Gentleman, he's a great senator, he's a great gentleman, Tim Scott. And I called him 2 days ago. I said, Tim, what do you think? Tell me, what do you think? He's very disturbed by it. He's very disturbed, and I'm very disturbed also. Please, go ahead.
President Trump, thank you. I have 2 questions, one on testing and one on Democratic states that you tweeted about. First, the money for this new testing support today comes from the CARES Act, which you signed into law 42 days ago. Did your delay in embracing widespread testing have anything to do with a desire to suppress the official number of U.S. cases and deaths as you try to reopen the country?
No, we just wanted to make sure that we had the proper machinery, apparatus, and everything else out there before people started wasting money. It's a method of saving money. We want to make sure we had even things like this. Plus, they have machines that are far more complex than this. They have massive machines at some of the laboratories that can do millions of tests. We want to make sure everything was in place. Okay, go ahead.
And earlier today, you tweeted that Democrats are moving slowly for political purposes. Why do you believe that their motive is politics rather than public safety? And how do you respond to criticism that you're also motivated by politics to try to grow the economy ahead of the election?
Well, I think that if you look at Pennsylvania as an example, if you look at various other states, I won't get into them, the people want to go back. The numbers are getting to a point where they can, and there just seems to be no effort on certain blue states to get back into gear, and the people aren't going to stand for it. They want to get back. They're not going to stand for it. They want our country open. I want our country open, too. I want it open safely, but I want it open. Don't forget, people are dying the other route. You can go with the enclosed route. Everything's closed up. You're in your house. You're not allowed to move. People are dying with that, too. You look at drug addiction. You look at suicides. You look at some of the things that are taking place. People are dying that way, too. You could make the case it's in even greater numbers. So it's a situation that some people, and I've noticed that some states could be moving more quickly, and also at the same time safety. Look, safety is paramount, but people are dying in the lockdown position too. And everybody understands that. They're just starting to find out. And look at what's going on with drugs, and look at what's happening with suicides. Yeah, please.
Mr. President, there does seem to be a double standard here, Mr. President, where members of your own staff can get tests frequently when they need it, but ordinary Americans cannot. So when will the rest of America have the same access that members of your own White House have to testing?
And you know what? If we didn't get the tests, if we did no tests in the White House, you'd be up complaining, why aren't you getting tests for the White House? See, we can't win, because if we didn't get the tests, you'd be up. I understand you very well, better than you understand yourself. And frankly, if we did get tests done, you'd be up complaining about the fact that we didn't have the tests done. Now that we're doing so well on tests, and so quick and so fast, 5 minutes, et cetera, and so accurate, you're complaining that we're getting too many tests. So you can't win. Go ahead, Phil.
We had a situation here at the White House on Friday where a member of the vice president's staff tested positive for coronavirus, which has now caused 3 of the top U.S. officials involved in the coronavirus response to self-isolate. Two-part question. Where did the system break down to allow that to happen? And what would you say to employers who look at the experience here at the White House and say, are we ready for this?
I don't think the system broke down at all. One person tested positive, surprisingly, because the previous day tested negative, and 3 people that were in contact, relative contact, who I believe they've all tested totally negative, but they are going to, for a period of time, self-isolate. So that's not breaking down. It can happen. It's the hidden enemy. Remember that. It's the hidden enemy. So things happen. But the 3 tested negative. The one who tested positive will be fine. It will be absolutely fine. Yeah. John?
And what do you say, Mr. President, to other companies who may look at this and say, I don't know if we're ready for all this?
Well, I think, we have a lot of people in the White House, and we had one. Basically, we had one person. So we had a lot of people that work here. This building is shocking if you looked at the numbers, and it's also tremendous numbers of people coming in. Normally, you wouldn't do that. But because we're running a country, we want to keep our country running. So we have a lot of people coming in and out. Many of those people, most of those people are tested, depending on what portion of the Oval Office area they're going in. Everybody coming into the president's office gets tested, and I felt no vulnerability whatsoever, John. But the 2 people, as I said, and 3 people they have been tested, and it's negative, and they'll be probably out of quarantine very quickly. Okay?
President,
John?
if I can follow up on that, your staff, your senior staff, as you just referenced, is able to get tested every day. When will it be that Americans across the country will be able to get tested every day as they go back to work?
Very soon. I mean, really very soon. It's an interesting question because normally you would have said that you are not tested, and you would have been, knocking us for not getting tested. So if we get tested, it's a problem. And if we don't get tested, it's a problem. But I like the way your question was phrased better this way, because it is a positive. We are tested. We have great capability. You look at all of these machines here. They're incredible machines. They're the best anywhere in the world. No place in the world has this kind of equipment. Other countries are calling sophisticated countries, and they're calling lots of countries. And we're trying to make as much as we can available to them, because there's nothing like what we've been able to do in literally a couple of months. What they've been able to do, the private sector, how they got it done. This is a 5 to 15-minute test. As an example, the Abbott Laboratories test. These tests are highly sophisticated, very quick, very good. This is things that didn't even exist a short while ago. So we do have a great testing capability. At the White House, we're doing it. And I think, generally speaking, we had a call with the governors the other day. Generally speaking, without exception, they were all extremely happy with what's going on with respect to their testing. Okay?
But should people be told to go back to work until they have that assurance that they and their co-workers are able to get a test, which we're still not there? We're
leaving that up to the governors, as you know, and if we see something wrong, we'll call them out and we'll stop it. But we are leaving it up to the governors. Some are being not aggressive enough, in my opinion, and some are being a little bit aggressive, but they're being very careful. And the people of the country, they've learned a lot over the last 2 months. They've learned about social distancing and washing your hands and other things that we've all learned and talked about. They've learned about, I see everybody, just about everybody has a face mask on. They've learned about face masks, the good and the bad. By the way, it's not a one-sided thing, believe it or not. But our country has learned. Our country has been incredible. And you see the numbers, they're dropping very substantially. The numbers are dropping around our country very, very substantially. So we leave that, John, up to the governors, and I think they're making a lot of good decisions. We've had, as I said, a great relationship with governors, Democrat and Republican, and I think overall they're making very good decisions. Nobody in this group. All the ones behind the rope. That's interesting. Please.
Thank you, Mr. President. You said in your comments earlier, we have met the moment, we have prevailed. To you, sir, is the mission accomplished, even with 1.4 million?
No, we prevailed on testing is what I'm referring to. That was with regard to testing. You never prevail when you have 90,000 people, 100,000 people, when you have 80,000 people as of today, when you have the kind of death you're talking about, when you have potentially millions of people throughout the world that are dying, that's not prevailing. What I'm talking about is we have a great testing capacity now. It's getting even better. There's nobody close to us in the world, and we certainly have done a great job on testing. And testing is a very big, important function. By the way, some people consider it more important than others, to be honest with you. But testing certainly is a very important function, and we have prevailed. We have the best equipment anywhere in the world. Okay, please. Yeah. Please, go ahead.
There are a variety of reports that Chinese hackers are attempting to steal technology related to vaccine research. Is this something you're concerned about? What can you say?
So what else is new with China? What else is new? Tell me. I'm not happy with China. They should have stopped this at the source. They could have stopped it right at the source. So now you're telling me they're hacking. So I just say this, Steve, what else is new? We're watching it very closely.
If I could follow up, sir, the South China Morning Post, the Beijing newspaper, says that China would like to reopen negotiations on the trade deal to make the terms more favorable to them. Is this something you'd be interested in doing?
No, not at all. Not even a little bit. No, I'm not interested. We signed a deal. I had heard that too. They'd like to reopen the trade talk to make it a better deal for them. China's been taking advantage of the United States for many, many years, for decades, because we had people at this position right here where I'm standing, sitting right in that office, the Oval Office, that allowed that to happen. No, I'm not interested in that. Let's see if they live up to the deal that they signed. Okay? Please, go ahead.
Mr. President, what are your thoughts about a second round of direct payments to Americans that's included in the House Democratic bill?
Well, we're talking about that with a lot of different people. I want to see a payroll tax cut. I want to see various things that we want. I want the workers to be taken care of. But we are talking about that. We're negotiating with the Democrats. We'll see what happens. But as I said, it's a transition, and this is really going to be, in my opinion, we'll see. But I think it's going to be something that's going to be very special. It's a transition to greatness. And greatness is next year, right from the beginning. I think we're going to do fantastically well. I view the third quarter, as I said, as a transition quarter. Could be pretty good, but a transition quarter. Toward the end of the fourth quarter, you're going to see some numbers that are going to be tremendous, I think. And next year, you're going to have potentially the kind of numbers that you saw before, and maybe even better, because there is that pent-up demand that is, you know, a lot of people wanted to do things, they were ready to do things, and they've had to hold back because of the virus. So I think you're going to have, with that pent-up demand, a phenomenal year next year, unless somebody messes it up by coming along and raising taxes, doubling, tripling, quadrupling your taxes, like a certain party, namely the Democrats, want to do. You'll mess it all up. You know, we had the greatest in the world. I presided, this administration presided over it. It got great for a reason, and we'll do it again, and we'll do it again very quickly and very easily. I see that happening. Yes, ma'am, please.
With this newly emerging syndrome now among young children, what do you say to parents who would like to get their children back to school but are now looking at this and potentially afraid to do that?
Well, again, it's a tiny percentage, but you're right. So we're looking into it very strongly. And the Admiral, as he said, he's known about this for long before this happened. But it is a very, very small percentage. And people recover from that. The children recover from that. Right?
Yes, sir.